was waiting for someone to bring up nurses because if you're an attractive woman going into nursing, be prepared for the older nurses, especially in their 40s and up, to try to get you arrested over false claims. There's a girl on TikTok right now that's in her 20s. She's very beautiful and she's a nurse. And you probably know who I'm talking about. She's a black woman. She's now suing the Board of Nursing for $22 million because a bunch of older nurses were jealous of her. They found her social media, saw that she had a very good husband. She was going back to school eventually to become a nurse practitioner. They made up false reports about her. They somehow got her locked out of her documentation system and altered the documents.
Imagine dedicating your life to nursing, showing up every day to care for patients, and instead of being valued, being humiliated and punished because of the color of your skin. So that was the reality for nurse Dawnquanique Yvonne Joppi at the Medical Center of Aurora in Colorado. When she applied for advanced cardiac training, a charge nurse told her she lacked the intelligence and organizational skills, then mocked her by saying she could clean his house and clip his dog's toenails. She was falsely accused of stealing a white patient's credit card to buy a stethoscope, and instead of investigating, the hospital restricted her from break rooms and locker rooms, treating her like a criminal. While her white peers managed 2 patients in the ICU, she was overloaded with 3, and when she spoke up about the unfair workload, she was retaliated against with a performance plan. Even her tone and body language were policed in ways her white co-workers never faced. But the worst came when she stayed overtime to help a colleague honor a dying patient's end-of-life wishes. Acting under a physician's verbal order relayed by staff, she helped remove a ventilator. The hospital didn't back her. They fired her, claimed she acted without authorization, and referred her for prosecution. She was dragged through the courts on manslaughter and neglect charges that were later dropped in the interest of justice. So this month, a federal jury finally saw the truth. They awarded her $20 million, finding that HCA Health One discriminated against her because of her race and retaliated when she tried to defend herself. This verdict is bigger than one nurse's story. It tells every hospital executive racism, retaliation, and scapegoating have consequences. And it tells every nurse, every tech, and every aide, you are not powerless.
This is a very nuanced conversation. I'm going to try to not make all types of parts to it, but first and foremost, I have done caretaking and advocacy. So as far as in oncology, heart failure, heart transplant, end transplant, stroke, neurology, I've gone across the board, liver, like hepatic. I have a varied experience to dementia and Alzheimer's and hospice. Now, with that said, I have attended partially nursing school and some pre-med courses, only because I needed to know more information. In meeting people and knowing people and networking, I have seen nurses literally see something happen and deny it later that it actually happened. And these weren't just older nurses. They're CYN for doctors, and it goes all the way up to the top. I've had a social worker come in from me making a report for a patient, and this woman saying she never saw us when I had actually recorded her and recorded the writing. Because the executive of the hospital, a doctor, assaulted the patient. And guess what? That social worker wanted to protect her job. Why? Because all of you need your jobs. And this wasn't a non-black woman. This was a black woman. So if you're thinking, oh, this is all about racism, it's not. When people need their jobs, they don't see stuff. Integrity goes out the window. And this was in Texas, because if a doctor does not admit to negligence in Texas, it didn't happen. It's a hard proof of it happening, and you get a very low amount when you do prove. Definitely not 20 million or anything in the millions like Colorado. You better be very careful where you move to. I tell people all the time, do not move to Texas. You are taking your life into your own hands with this medical system in Texas. I suggest Seattle. I suggest California every time. I suggest Washington State, the West every time. In part 2, I'm going to be explaining more.